Today we're going to dive into anti-inflammatories, of course, on the natural side. The one that comes to mind instantly is curcumin. Comparative studies have shown that curcumin can reduce inflammation and pain pretty much levels similar to nonsteroidal anti-inflammatories, especially in osteoarthritis and others. And they're as effective, they've shown, even as diclofenac. Curcumin works through multiple pathways, by the way, including inhibition of inflammatory cytokines, COX-2, etc. And it is generally very safe. One challenge with curcumin, you may be aware, is its low bioavailability. It's difficult to get it into the bloodstream and getting good absorption. So they try to make liposomal forms and putting piperine, black pepper, into it, but now nanoforms seem to have taken the front stage. Boswellia, or Indian frankincense, has been studied also for its potential, especially like in rheumatoid arthritis, and it does help joint pain and swelling as well. That's frankincense. Studies indicate that it does manage inflammatory diseases, even like Crohn's disease and ulcerative colitis. Now, it does help even in asthma as well, but they found that the inhibition in this particular case, Boswellia, is its inhibition of 5-lipoxygenase, or LOX inhibition. It affects also blocks pro-inflammatory cytokines and reduces inflammation at a cellular level. We also could look at something called holy basil. You've probably heard of that as well. And it generally provides mild to moderate anti-inflammatory effects. It's used as complementary therapy instead of as a frontline, as curcumin and Boswellia are. And it too works through multiple pathways, and it's been shown to be good, but it's not as robust as Boswellia or curcumin for that matter. Resveratrol, which you probably didn't realize has anti-inflammatory effects because it affects the initiation of the nuclear factor kappa beta pathway. And of course, that's critical to inflammation, and it can reduce tumor necrosis, factor alpha, other interleukins as well. So it is also a particularly important addition to the team for anti-inflammatories in the natural family. But both curcumin and resveratrol, once again, can modulate nuclear factor kappa beta. Now, green tea, which we should absolutely take a moment, the active ingredient, the EGCG, it can definitely modulate the immune response, and it does reduce inflammation quite well, especially arthritis, cardiovascular inflammation. If you have a high C-reactive protein, it can help, and other neurodegenerative disorders. Again, it like resveratrol and curcumin, it does affect and inhibits nuclear factor kappa beta, and it does neutralize free radicals. So it works wonderfully together. So if you're looking for a complementary way of adding things together, I give you an easy triad to think about. That is the curcumin, nanoparticular seeming to be the best for bioavailability and sustainability in the bloodstream. The Boswellia, a good nanoform as well, somewhere between 1,000 and 1,500 milligrams seems to be an optimal dose. And of course, the EGCG, a good form, at least 50% of a green tea extract, that's EGCG. Those three combinations seem to be a wonderful sort of complement of each other and inhibit the nuclear factor kappa beta pathways, the interleukin 1B, the interleukin 6, and those other inflammatory critical things. You want to add a little ginger onto that, and you want to add a little holy basil into that, no problem. But again, it's the overlapping and blocking of the different pathways by just those three things in the triad that will certainly help majority of your patients. Thanks for watching. If you have any other questions or information that you need, just contact me at Dr. Mitch Ghen at mitchghen.com. That's DrMitchGhen at mitchghen.com. Thanks so much for watching.